Welcome to Joa Fitness Health Wellness Video Podcast, a space to ignite your day through positive conversations. We bring people that have created excellence in their life, sharing high vibration in their reawakening path.
Hello, happy Friday, and welcome to Back into Alignment. Here, your host, Joa Rivas. I have been hosting this space to come back into alignment every Friday to have solutions and strategies to heal our body, especially if you are experiencing neck pain, back pain, or any type of spinal health issue. Why? Well, let me tell you, I used to have scoliosis, and not only scoliosis, but actually chronic back pain for the last decades. Before, when I was 15, I was diagnosed with scoliosis, and I spent 10 years having chronic back pain. It was not easy and not fun. And after practicing yoga and Pilates, I actually recovered, and I found my stability and my strength. And it was a great journey. But after 12 years of having no pain, competing on fitness shows and all, I started experiencing, again, very subtle pain in my lower back. And I realized that I needed to go back to the doctor. And I find out that I have osteoarthritis and I have some issues on my bones related to degeneration of the bone, like herniated disc and slip disc and osteoarthritis. So this actually has been bringing me back into alignment one more time to understand that our body is in a constant change, and there is so much habits and so much we can do in our life to be able to come back into alignment. So that's why this actually podcast has helped me in my human journey, and also helped me to support my clients and my team to be able to understand that our body is a unit that is connected from head to toe, and we are all holistic being, that we can understand how the mental health and the physical health is connected together. And this is why I love this channel, because most of the practitioners that I invite to have talks, they are always approaching to their bodies through a holistic way. So today we are excited. This is February, and I am again welcome you to join our posture school program, which is a 16-week program. Is a program that you can do from home, and it's basically 16 weeks where you are practicing between 15 to 30 minutes a day, stretches, strengthening exercises, especially to understand how to activate your glutes, how to strengthen your core muscles, and also how to learn about the posture awareness. If you are experiencing issues because you are hunched over, or maybe because you have some congenital issues like spinal issues like scoliosis sometimes, or even sciatica, this is the channel for you. And Posture School program is definitely a program that you can actually practice to be able to learn, because at the end, our body, it requires a consistent practice and awareness, more than a Band-Aid or more of a therapy that is only giving you results for a few minutes, hours, or days. We definitely need to know that our solutions are in our hands, and it's all about implementing daily habits. So this program is for you. You can just go to joafitness.com and check the program, and if it fits your goals, then definitely I welcome you to join the 16-week program. And especially for the beginning of the year, we are working on a 30-day hip healing, which is a little bit shorter commitment. It's only 30 days. And I invite you to practice between 10 to 30 minutes a day stretches. You can do it at the office, at the chair, or you can also do it in the floor. So these programs are also helping you to understand the habits and how to implement these actions into our daily routine. Just taking some breaks during the day, it will always help you. So I invite you to check my website, joafitness.com, in the individuals area, and you can actually check these two programs that we are offering at the beginning of the year. But coming back into alignment one more time here into our talk today, we are going to have physical therapist that was graduated from the Mayo Clinic, and he is an expert in migraines and headaches. And it's really interesting how we cannot disconnect our neck and jaw from our body, and how having tension around the neck and the jaw can generate a cascade of issues like migraines and headaches. So very interestingly, sparked by the interest of learning more about this specific issue, we have Jono Taves, which is an expert in this specific topic. And interestingly enough, his mission is to empower everyone with headaches and migraines to break free from a life of pain and dependence on medication so that you can thrive in everything what you do, which is very important, especially if you can actually find natural ways to heal and understand the underlying issues. This is actually one of the missions that we have with the channel. Actually, Jono Tapes is in Colorado Springs, a beautiful place where he has a clinic. And in this clinic, he actually brings solutions for those that are experiencing this type of diagnosis. We're going to be chatting about why the neck needs a proper evaluation to be able to understand the issues happening in the head. And also, we will be talking about what type of screening he does to understand more of his patients. So, without further ado, let's invite to our podcast to physical therapist Jono Taves. Hello, everybody. Happy Friday. We're back. Yes, another week and another month. This year is going so fast. We are already on February and excited to bring you a new topic after talking about Ayurveda and the benefits of the longevity medicine. We actually have this month a very specific specialist in the headache and migraines. Why? Because I hear so many people constantly coming to me telling me, Joa, I could not sleep with these migraines affecting me. Starting with my mom. My mom has been having migraines since a very young age. And it really creates so much tension around people when they're actually having this pressure on the heads, and especially when you don't know the why. So interestingly, Jono Taves, who is a specialist on this specific topic, has been interested in sharing with us, with our community of Back into Alignment, the why and the discoveries about the connection between our neck and our spine, and why are we having these issues, and they can actually affect our bodies. But first, let's get to know Jono Taves. How are you, Jonathan?
Yeah, I'm good. Thanks for having me on the podcast, Joa.
Yes, great. It's awesome to have a new guest. I get to understand the why of why they're doing what they're doing, and also the story. So let's just start with the very beginning of Jonathan, like how Jonathan was when he was a kid, and how long does it take him to actually learn about the migraines and become an expert on migraines.
Yeah, I guess I'll start with the framework was probably laid as a kid to some extent because I was a soccer player, so I played all through college. Okay, so it was a big part of my life in college. I essentially went to school to play soccer. The degree was sort of a secondary thing, but at some point my mind shifted and I realized, oh, I got to get a degree. And so, knowing that I liked to exercise and the physical body and how it works and how it functions was really interesting to me. So I majored in exercise science. So I have an undergraduate degree in exercise science, and then I was curious about physical therapy because you don't really get paid too well to like the exercise science degree can go a lot of different routes. But if you're going the personal training routes, you don't necessarily need that degree, although it's helpful. What was a natural secondary to that undergraduate degree was physical therapy. I didn't know much about physical therapy, but I started to shadow physical therapists and saw that they enjoyed what they did. And so I looked into physical therapy programs. I got into the Mayo Clinic out in Rochester, Minnesota, and went through that program. Probably a year or two in, I started to get maybe a little bit frustrated because the general physical therapy approach, and if your listeners, if they've been to see a physical therapist, it's probably an open gym setting with exercise equipment, and people think of physical therapy in the context of like post-surgical rehab, which is not wrong, but there's a lot more to physical therapy. So when I first started working in these clinical experiences, that was kind of the experience I got, which I didn't love a ton. I mean, it was the physician referred a patient and we're rehabbing them, taking them through like a standard protocol of exercises that the doctor approved. And it just didn't feel like I was challenging myself or using all my clinical skills. And then I ran into these really good clinicians that were doing what's called manual therapy. So they work with their hands. One of them taught a weekend course at Mayo on the neck and the jaw. And so I got to understand sort of the biomechanics and how the neck moves and the jaw functions. And I was fascinated by that. I went and shadowed him, and he had people traveling from all over who were having all sorts of neck headache type issues, and they were finding really good relief with his process. And so that fascinated me. So I learned from him. I learned from other providers that were in this space of manual therapy, treating the neck. And I started to treat patients with headaches right out of school. So I had a fair amount of patients with headaches on my schedule, and they would get better. I found this problem with their neck. I would restore function. I'd apply these manual techniques, and it worked really well. It was very rewarding. And I would occasionally would have someone with the migraine diagnosis that would come in. And at first, I didn't really know what it meant to have the migraine diagnosis. And I thought this was just something the neurologist should see. And this is medication. This is a neurological thing. But what happened was they would tell me that they've seen 2, 3, 4 neurologists and they haven't found the relief they're looking for. And they've been taking these medications, but the medications haven't provided them with relief, or they maybe get relief, but the side effects are enough so that they don't want to keep taking them. Or maybe the medications just wear off. Like the medication was not the answer. People weren't provided with an alternative. And so I would evaluate them the same way I was evaluating these people with headaches, and they had the same neck problem. Obviously, their symptoms were much worse, but the neck problem itself seemed to be overlooked. And so I'd take them through the same treatment approach, and they would get better. They would get profoundly better. So they would find more relief than they had found through any other treatment source. And so that got me really excited. I saw a migraine patient after migraine patient over and over again, and got to the point where I said, this is such a gap in our healthcare system, and physical therapists aren't addressing this like they should, that I just need to create a center specifically for these patients so that we can build trust with them. We can get the repetitions in, because it's a complex thing to treat. And that's essentially what we've done. So this is year 5, having Novera Headache Center, and that's what we do. We're physical therapists. We apply techniques mainly to the neck, but the jaw and the shoulder as well, to help manage the underlying source of a lot of these headaches and migraines.
Yes. Okay. Yeah, that was a long story, and I didn't want to interrupt you because I understand that every that you are following is getting you to where you are right now, and very excited that you actually saw a little bit of a gap happening, and then you brought a specialist center into your area. Which did I catch it? Is it Minnesota?
My center's in Colorado. I went
Colorado.
to school out in Minnesota, but I
Okay.
grew up in Colorado, so I'm kind of back home now.
In Colorado. Okay, nice. Yes. And this center receive a local community, like how are there more women than men? What do you see are the trends coming these last years?
Yeah. So as far as when we look at headaches and migraines in general, women are 2 to 3 times more likely to experience headaches and migraines, probably more in the migraine category, but there's different types of headache diagnoses that men might find more prevalent in them. But for the most part, we see women. We're probably 80% women, and the demographic is probably 20 something to 50 something year olds. And that's the window where these migraine symptoms can really, I guess, plague and be debilitating for our patients. And they're really motivated to find relief around that age, even though a lot of them, their symptoms may have started, when they were little, 10, 12, something like that. And it's been off and on. And then they get to the point where in their 30s and they're like, okay, I really need to figure this out.
Yes, exactly. So as you were commenting, the issue with the migraine is actually affecting about 1 billion of individuals all over the world. So it's something that is definitely something we cannot ignore. It's affecting so many people. I'm sure either you or somebody in your family is experiencing headache right now. And it happens that it could be a lot of the causes. So as you are putting so much effort and focus on this particular health issue, what do you see that is the most common problem that is underlying on affecting this issue, because we actually had in the past another a specialist in the neck area, and he actually was commenting that there is so much tension and so much restriction around the neck area that this is actually affecting the flow of blood into the brain, which actually causes the migraine or headaches. So again, I would love to hear your opinion and your angle about this particular issue.
Yeah. So the thing that's going to parallel what that provider was talking about is we're looking at the neck. I'm going to deviate a little bit as far as like the impact of the neck. We look at it less of like impacting blood flow, even though there are studies that do show there can be some impact on blood flow with upper cervical restrictions. But essentially, if you think so, physical therapist, we look at the body in the sense of like we want to restore function and movement. And so when someone comes in with any sort of head or facial pain, we're going to assume that the neck has some sort of issue with it, just because the upper part of the neck refers pain into the head. Okay, so that's known, that's researched, that's well studied, that a referral pattern anywhere from C1 to C3, so the upper part of the neck. So if the listeners push on kind of the fleshy part just below their skull, top part of their neck, that's the area I'm talking about. So that area, if there's a pain signal, if there's tension that's generated because of a loss of movement, there's a few joints up there that are responsible for most of our, let's say, nodding and rotation, and it's holding up our 10 to 12 pound head. So it's not uncommon for restrictions and sort of injuries to happen way up high there in the neck. It could be there just from life and postures that we put ourselves in, to like a car accident or some sort of trauma. But typically there's some sort of injury that's causing tension. And so the brain is picking up this pain signal from the upper part of the neck, but it's perceiving it as coming from the head or the face. The reason it does that is because, so we have these sensory nerves that pick up the signal from the neck. They travel through the brainstem and they access the brainstem through what's called the trigeminal cervical nucleus. So this is sort of like a place where all of these different nerves meet up. One of the primary nerves that is probably known to a lot of people is this trigeminal nerve, which picks up sensation from the face. So that nerve meets up in the same trigeminal cervical nucleus, and then it sends a common signal to the brain. Now, the way pain works is we don't actually acknowledge, and this is true for any type of sensation, but we don't actually acknowledge what's happening until it hits our cortex, okay? So that signal traveling through the brainstem, meeting up with those other nerves, sending a common signal to the brain. What happens is the brain gets that signal and doesn't necessarily know where it comes from. If it's intense enough, like with migraine symptoms, we see it confusing the type of sensory input as well, like maybe a visual disturbance. And then it also will create this hypersensitivity and other sensations like smells, bright lights, things like that can be very hypersensitive when this sort of very loud, obnoxious pain signal is hitting the brain, and it just thinks like everything is sort of malfunctioning in a sense.
Exactly. It's the way how we sense pain. So it's actually such a crucial area. We actually know that the neck is often the most likely underlying cause of the pain related to the migraine. I'm actually a Thai massage therapist since 2013. And everyone loves head massage because it releases so much tension around the temples, about the skull, like what you were saying, those 2 points on the bottom of the skull. If you really want to give some love to anybody, please press those 2 points on the bottom and people will just like melt in your hands. So we definitely are accumulating so much pressure around our head. And as we're sitting, our head is just there somehow maintaining the stability on the neck. Also, are we sleeping properly? So why don't we just dive deeply into 3 common mistakes that we are implementing or we are actually doing in our daily routines that are actually affecting us and generating migraines.
Yeah, well, we have a framework. We call it our 3-step plan for self-management of headaches and migraines. There's 3 main things that are overlooked, and we can get into, I guess, more detail of like maybe a specific stretches or exercises, but the general principles that we take people through when it comes to self-management, reducing the level of tension and stress in their neck. You mentioned sleeping. Sleeping is a big one. We want to get your sleeping position corrected. That's part of a broader step, which is step one, which is have time be on your side. Okay. So we all have different activities, postures that we sustain throughout the day. Those can either be like aggravating and increase the amount of stress and tension through our neck and shoulders, or they can be therapeutic in a sense. And so being aware of your postures, of how much movement you're getting throughout the day. There's not necessarily like a perfect posture. What we tell people is the next posture is the best posture. So obviously, if you're sitting for an extended period of time, sitting upright is important. So you don't want to be leaning to one side or rotated. You want to be in a neutral position, but ultimately we want you moving as much as you can. And that also, when we think about this, like sort of mindfulness throughout the day, thinking about our body, if we're adding stress to our neck, as our neck is tasked with holding up this 10 to 12 pound bowling ball, we also want to think about when we're sleeping and when we're resting. It's assumed that sleeping in any position is going to be helpful or therapeutic, but actually we find that especially stomach sleeping or any sort of rotation up through the spine when we've lost specific joint movements. So one of the big joints that we work on, or at least a lot of our focus is there, is C1 and C2. It should allow us to turn our head. It does half of our rotation, so about 45 degrees. That's lost on most people. So when you sleep, you want to think about getting your neck and your spine in as neutral of a position as possible. Otherwise, there might be increased stress through your neck. Okay, so just being mindfulness about your day is number one. And then number two, we could say is just implementing a regular exercise program. There's a lot of benefits to exercise as it relates to your body's pain threshold and tolerating pain. And so anyone with chronic pain, like if you're going through a specific like pain management program, exercise should be a part of that. Exercise should be a part of anyone's routine, but I think someone with headaches or migraines, it's understanding what your body is capable of, taking baby steps to build your body's tolerance to exercise. But I think implementing a regular exercise program is very beneficial. And so that's kind of number two, is we want your body to have a good kind of stress on it. And that's what exercise can be, a good stress. So you're increasing your body's tolerance. And then the third step in our, I guess we call it our 3 steps of self-management, but self-management being like step 3 is sort of advocating for yourself. So you understand your problem, and then you want to find a provider that can help you with that. So whether that be a massage therapist who understands the neck and the jaw and the shoulders and can work through that stress, to a physical therapist that does these manual therapy techniques, which can be challenging to find, but they're out there. It could even be a chiropractor or an osteopathic doctor or something like that. But if you need in-person care, that would be like the third step of what we call our 3 steps to self-management.
Yes, exactly. There is actually a holistic approach, which is most of the people that come into this podcast are usually looking at the body as a unit. So we cannot take one piece away. We all connected together. We know that there is a correlation between our neck pain and our emotional state. So definitely having proper breath work, breath awareness is very important. As a yoga teacher, I'm constantly reminding everybody to come back into your very slow, mindfully breathing that can actually regulate your parasympathetic and can actually help you to release the tension around your head and neck. So definitely this is very important. Looking for a provider is also important, even though I bring healthcare professionals. I always invite you to visit your local doctor, or even if you want to take a trip to Colorado and get to be on the Novera's Headaches Center, you're also welcome to visit Jono and his team to take a look about what's happening with your body. I know that some people have severe migraines and headaches. Talking about somebody that is constantly a daily migraine, that's definitely not normal. I wanted to also ask you on these cases, if anyone that is listening to this podcast and is actually experiencing since childhood a very severe migraine and headache, I wanted to just talk about the light. Is it like something related to the light affecting our eyes? if it's more related to congenital. Is it any proof that shows that we can actually have this on our genetics? We're talking about more of a severe migraine cases.
Okay, so you're asking people with severe migraine, they trying to explain if there's a genetic component, like what's triggering it. Is it outside of this neck situation? Is that what I'm hearing?
Yes, exactly. Like somebody, I'm just saying, if somebody by any chance is listening to this podcast is like, oh, well, what about me? I'm having headaches and migraines every day since I'm 5 years old, and I haven't been able to find a solution. I'm wondering if you have those type of cases with a positive outcome after visiting you.
Yeah. So most, probably 80-90% of the people we see have the diagnosis of migraine. We generally are seeing people that have had decades worth of these symptoms, so they've dealt with them for a long time. And most of our patients are having weekly symptoms. So that could be once a week. That could be, we do see people that have daily symptoms. So there's all different categories of headaches and migraines and the diagnoses that you could receive. One of the general principles that we do see pop up in almost every case is this neck problem. So we want to pursue that initially. Now, trying to understand the why behind it, you mentioned genetics, you mentioned, is light a trigger? So when it comes to understanding triggers and then understanding how the neck problem, like how these can all sort of blend together, how I like to explain that is if you think of these two lines, and so there's a threshold line and a line of tension. And so everyone that is experiencing headaches, migraines, we're going to assume they have a level of tension in their neck. And so, but they're also, their body's going to have a threshold, so it can tolerate a certain amount of tension. If that tension increases over the threshold, then you'll experience a headache or your migraine, or if the threshold drops. And so both are sort of dynamic. They're moving, they're adapting to, whatever your day looks like. And so the tension itself might be responding to postures, maybe stress to an extent, and increasing the amount of tension through your neck, physical activities, things like that. But the threshold is oftentimes what people think of as like the triggers that they pursue to sort of explain why this is happening. So triggers could be light or sound sensitivity, bright lights, bright sound. So that's just goes back to the hypersensitivity that these nerves have, that the sensory input has, because of that chronic pain state of the pain that just constantly is sort of hitting the brain, and the brain just isn't able to tolerate these other sensations. In addition to that, things like barometric pressure can be explained through thinking of the joint as having some irritation through it. So there's some inflammation and some pressure built up in the joint itself. Well, if the barometric pressure drops, just like someone that has arthritis in their knee, they'll be able to tell you when it's going to rain because their joints stiffen up. So same thing in the neck. Like a lot of people that have this problem will be triggered by pressure changes. Genetics, there is some data to connect. It's not strong. So like when it comes to genetics, what we would utilize to explain that is that you inherit your mom or dad's anatomy. Okay. So maybe you're genetically predispositioned to a forward head posture, forward shoulder, that sort of thing. And so because of that, or joint laxity or instabilities or whatever it may be. And so if your mom or dad had that, you're likely to have that. So it's not like you inherited your headaches or your migraines, but you were predisposed to the same sort of anatomy that maybe led them to have it as well. So that's the difference there is all of those things are maybe impacting their threshold, whereas we have to consider the tension where the pain's actually coming from as well.
Yes, it could be very complex, definitely. Thank God I don't have headaches, and I know I do if I am dehydrated. That's definitely a trigger for me.
Yeah.
I did fitness shows 10 years ago for 6 years, and I taught myself to have so much water. So my body's a little bit spoiled. So if I'm actually not drinking 2 to 3 liters of water a day, I notice definitely a headache. So definitely the trigger for me and my body is related to dehydration.
Yeah.
But I see many of my friends having daily headaches, and some of them get actually like a blackout. They lose their even the sight. They have to lay down. They have to use an eye mask. So I see there are other people that have actually a severe health issue that can affect their regular activities. which is why I wanted to bring this podcast for those people that are actually looking for something that is more precise for what they're experiencing. And interestingly, I see that you're doing a holistic approach, which is something that I love to bring, understanding that it's not only one area. It could be a play of so many factors to be able to understand and to evaluate these type of problems that we are experiencing. Now, Jonathan, I would love to hear about a little bit before we finish our first talk is about your podcast. I know you have a podcast too that is related to headaches, and I can imagine how important for you it is that you actually develop a whole podcast. It's called the Headache Doctor Podcast. So tell me a bit about this channel and what's your intention to have this channel.
Yeah, so it's called the Headache Doctor Podcast. On the podcast, I say it over and over again, but it's our mission to educate and empower everyone with headaches and migraines so that they can break free from a life of fear of your next headache or migraine and dependence on medication. Okay, so in the headache and migraine world, and especially in the podcast world, there's not too many podcasts that are going to be helping people get outside of this world of medication. Okay, so there's all sorts of resources if you want to go down the medication route. I don't feel like that's an area that people really need help in. They need help in understanding what might be causing this and how to get out of it. And so what I do is I will come up with different topics every week. We do interviews with other providers that are kind of in a complementary space that have maybe a different lens, but still outside of medication. Okay, so pretty much every podcast, we want it to be educational and empowering. We've had a lot of people that listen to the podcast that are able to pull away some very practical things, make some changes, whether it's in their mindset or their daily activities, and actually see some good relief in their own symptoms. And so just by listening to the podcast, you could see a change in your situation, which is fantastic. We love that. I'm trying to, this is such a huge problem. So I feel like I need a platform such as a podcast to really get the word out. And so we're trying to grow it, and it's done really well, and it's helping people, and I love it.
Yes, that's awesome. Yeah, you can imagine, especially now we have the power and we have the access to share what matters for us, and we never know how big this community can grow. So interestingly, I have other doctors talking about headaches and migraines with specific solutions. And definitely, I think it's a topic that it has a lot to be growing. So it's actually interesting that I would love to get to hear one of these episodes. I'm gonna check and share with my people. Sometimes podcast is a way to have a library of content,
right?
And then we just share with the people that will get the benefits of listening to this information that sometimes is misled, or sometimes it's just some misconceptions related to this. And
right.
I remember the last time I got a headache, it was because I wasn't drinking enough water, of course. And then I was very close to taking medication. I was like, I'm going to take an Advil or something to stop this pain. But it's like, you know what? I'm going to go to the yoga class. I'm going to drink some water and I'm going to see how I feel after an hour. And that's it. Definitely, I did some breath work. I did some hydration, and then the headache went away. So good. I didn't have to go to that path, which I also try to avoid medication, which is something that is very close to your mission, which is bringing pain-free solutions without the drugs, which is actually really good. I think we will talk in the future, and the next week we're going to be talking about the pain, how has been overlooked, especially in terms of the insurance, and how do you see the future for healing the migraines and the headaches. And you, as an advocate of health, I would love to see what would be the future of the center. If you notice that it's growing so big that you're actually going to open another location, we would love to hear about this, Jonathan. One question before we finish. Do you have any workshop or something to share with our community?
Yeah, we have what's called the Headache and Migraine Masterclass. So it's a course on our website. And so if they use a promo code alignment, get 10% off our masterclass as a thank you for having me on the podcast. And then we have health coaching partnered with that. So if someone's not able to come in person to our center, we can work with people virtually. And actually, it's obviously looks different than our in-person care, but it's very effective. And so the masterclass is part of that, but if they just want to buy the masterclass, they're welcome to do that. NoveraHeadacheCenter.com is the website where they can find that.
Okay, Novera. I'm going to add all the chat notes with information about this particular promo. And I also welcome you to check the yoafitness.com website, where we have also coaches, and we also have libraries with videos. And particularly for this one, I will be sharing an open access to neck stretch routine, which is about 5 to 6 minutes. You can do it anywhere. You can do it at your office. You can do it at home. It's about 6 minutes releasing tension around the neck. And it's free access for those that are actually sending a message with the word, with the hashtag no headache anymore. So you send me that, and I will send you right away an email with the access to the 6 minutes video, where you actually can get to practice this on a daily routine to be able to release tension around your neck. Plus, we have Jonathan's offer where you can actually access to the whole course if you are anywhere. He has that online program, so which is awesome. So thank you so much, Jonathan. And this weekend, what are you planning to do?
Oh, what am I planning to do? We actually have a little team retreat tomorrow. We're gonna get breakfast, and we're gonna do some laser tag. I'm really excited about it.
That's fun. That's fun.
Yeah, it'll be a fun weekend. What about you?
Well, my weekends are always busy. I actually have this Sunday the full moon sound healing. Basically, every full moon we gather in the Toronto Clubhouse right in the heart of Toronto in Canada, and we focus on breath work and resolutions for 28 days. Every full moon we meet again and we evaluate what we got done, and it's a great way for us to get progression with one goal in particular. So that's going to happen this Sunday. It's the full moon. We have sound healing, so we use music and light as a way to connect to our hearts. So it's a beautiful way to simply breathe in a community. So we welcome you on Sunday for the full moon, and we also can't wait to have you next week, Jonathan.
Yeah, I'm looking forward to it.
Thank you so much, everybody. And remember that together we are stronger.
We invite you to subscribe to this channel and share with your community. Please leave comments below, and if you like the episode, click the like button. Have a beautiful day.